Hey guys, this is Jackie and Tad with Flourish Medical and Wellness.
And we are back talking about injectable weight loss medications, semaglutide and tirzepatide, very commonly used medications for both weight loss and body composition. But Jackie, will you talk with us a little bit about how you dose these medications, how you titrate or change the dose, and also monitoring during that process?
Yeah, I'd love to. So a couple really important things is when we're looking at dosing, there are a couple ways to do dosing. You can do the standard dosing that is set forth by the manufacturers of these products, where you are doing a weekly injection and then titrating up every month into that highest dose. What we find to be a little bit more effective is doing what's called microdosing. So we are giving the lowest possible dose where it's the most effective and we're seeing minimal or hopefully no side effects. So what that looks like, and our goal is to have our patients losing 1 to 2 pounds per week, which is a very healthy amount of weight loss, and then not having the GI side effects, the nausea, the headache, those types of things. So when we find that sweet spot of 1 to 2 pounds a week of weight loss and no side effects, that is your sweet spot dose. That is where we want to keep you until you've reached that weight loss goal. The other thing that you mentioned is monitoring, and monitoring is super important. So we are doing things like monitoring our cholesterol, we're monitoring A1C, we're monitoring insulin resistance, we're monitoring different cardiac markers. And this is so important because it's not just about weight loss. It's really that these medications have so many benefits in the longevity world, in the overall health of a person. And so we're seeing improvements in things like cholesterol and blood sugar and insulin resistance. And most importantly is we're monitoring their body composition. And so we're able to look at body composition testing every 2 to 4 weeks to really give us a better idea of what's happening with our muscle mass, what's happening with our fat mass, and most importantly, where's our visceral fat? Visceral fat is that bad fat around the organs. It really sets us up for long-term disease processes. And so what we see is that these medications not only reduce our fat, but it reduces our visceral fat. But what we track very, very closely is muscle mass. Because if we see muscle mass loss with these medications and we're not supporting the body appropriately, we're actually setting our patients up for failure. By stopping these medications, then they're going to be worse off than where they started because we haven't paid attention to their muscle mass and we've actually worsened their metabolism. So tell us a little bit about diet, nutrition, activity, and how that plays into the muscle mass and what we're doing.
For sure. When we look at nutrition, there's a lot of different components to that, but looking at the main components that a person should be eating, it's prioritizing lean protein sources and vegetables with some fruits and some healthy fats as well. And that individualized protein need needs to be discussed in detail because it does differ from person to person, and it can even differ throughout that process of weight loss and looking at body composition. Best lean protein sources are going to be things like chicken, fish, eggs, turkey, lean ground beef, Greek yogurt. Those are going to be your best options for most people. But then also looking at when that person is eating, because things like intermittent fasting can be incredibly helpful when looking at blood sugars, helping fight off or improve insulin resistance in that process, because we want to decrease that insulin resistance as we age, especially for cardiometabolic health. The other piece is looking at activity. And like Jackie had said, we want to maintain muscle mass because that's going to help metabolism, and long term it's going to be one of the things that really helps with functional quality of life. So resistance training, we prioritize that over just pure cardiovascular training, and that is something where a plan can be tailored to that individual to really highlight what the needs are for large muscle groups and also for functional strength to maintain that body composition as we're losing weight and to ensure that the weight that we're losing is the weight that we want to lose in fatty tissue. But Jackie, what are the other key points that you look at?
So, overall at Flourish, we're looking at other things like what are their nutrients, what's going on with their sleep, what's going on with stress, what's going on with cortisol, all of those things. And so this really is not just about losing weight. Yes, we want to look good, we want to feel good in our skin, but it's so much more than that. And weight loss is not just about diet, nutrition, and these types of medications. It's the whole picture, it's everything. So we take a deep dive into all of those things, and everyone's a little bit different. So that's how we approach these medications and how we've seen things done well, done not so well. Anything else you'd add?
Just that the plan needs to be personalized. It really is important to take time in developing the plan on the front end because that's what's going to yield results throughout the entire process. And there are periods where things are going very well. There may be periods of plateaus as well, but following through with a well thought out plan that is customized to the strengths of that individual, that's really what we found to be successful.
Awesome. Well, we will be back again talking a little bit about what we've seen, some of the examples and things that we've seen clinically with our patients and even ourselves. So we'll talk soon.